Dr. Scott Sears from St. Vincent Healthcare every other Tuesday. And Doc, it's good to chat with you, but by golly, it is great to actually see you in person today too. That's a really good sign. Sunny skies and the doctor's here in person.
Yeah, and it's actually great to be here. And I think a little bit symbolic. We can talk about it, how a return to not necessarily normal activities, but more normal activities, interacting with people face to face, although we didn't greet each other like we normally do, shaking hands, did more of an elbow bump and staying 6 feet apart. But it is great to be back in the studio as opposed to calling in on the phone.
Well, and we were talking just before we kicked off the show here too, that, what's it been like the first week or so as things get, more back to normal at the hospitals? You started the elective procedures. We caught up with the COO of St. V's a week ago, and so he was just, you could tell just how excited he was and how excited the folks at the hospital are to just get back to seeing their patients and doing these elective surgeries, which are really, that term elective, as we talked a couple of weeks ago, is... It's not like a nice to have. It really is a need to have.
Yeah, it's a necessary elective surgery. Elective in the sense that you elect to have it at a certain time period, but you can't postpone it indefinitely. I have a patient in the operating room right now who is getting an artificial hip put in, hasn't been able to walk in 8 weeks, and his surgery was postponed a week that we canceled elective surgery. So he's been sitting at home suffering with this hip because it's, quote, an elective procedure. Elective, but completely necessary. And so being able to help people, which is why we went into medicine in the first place, and offer them a full range of services while still exercising appropriate precautions to protect them. Yeah, it feels great for everybody down at the hospital.
And you were telling me too that it's really been reassuring for a lot of these patients, a lot of these people now to because people naturally have their fears, they have their concerns, but they haven't been treating maybe some of their medical needs in the meantime because of the coronavirus concerns and things being shut down by and large. But you said they were really reassured to actually sit face to face with their PA or their nurse or their doctor.
Yeah, I mean, because it gives them a chance to ask questions that they've been ruminating on, and they've been listening to either, major media on evening news and not sure, is that right? Is that not right? Does that pertain to Montana, or is that more national? Is that pertain to me, or is that just the general person? And being able to sit down with your provider who knows you well and understands what's going on with this pandemic locally as well as globally, and ask those questions allows people to kind of continue to live their life, take care of their other medical needs, and get the reassurance they need while still not minimizing, the impact of this. And that's been really, really crucial for folks, because there are innumerable number of folks who have stayed home with really serious symptoms because they were more afraid to go to the hospital or their doctor than they should have been, and they ended up with a worse consequence because they were afraid of going to the doctor and just stayed home and dealt with symptoms that actually were very serious and even life-threatening.
COVID-15 from the COVID-19. Was chatting with Dr. Scott Sears here from St. Vincent Healthcare. Yeah, doctor, you were telling me how that's a real deal. There's a lot of people who have piled on extra weight as a result of maybe working from home or being more stuck at home now after the quarantines and the stay-at-home orders and all of that. But we knew there was going to be a backlog and kind of a pileup of other medical needs that either needed to be addressed already or might even get worse because people weren't addressing them over the past few weeks. What kind of a pileup, I guess, shall we see, are you seeing out there in this first week or so back up and running?
Yeah, I mean, I think that it's two groups of folks, right? It's the folks who have the chronic conditions who needed to be seen during this period and just didn't come in. Or there's the group of folks who actually have symptoms and they've been postponing. And so it's kind of two buckets of folks that are coming in. But what we're seeing is, volumes are significantly higher. Finding people, I had to double book patients yesterday, to get them in, whereas 2 weeks ago it was pretty easy to get someone on a video almost immediately when they call in. And so access to providers is a little bit more limited because of that. And people, frankly, just need to make sure that they're touching base with their professionals team. The nurse can answer a lot. I do a lot of telephone consultation, a lot of video consultation, and those are very flexible with hours. But we're seeing a massive number of folks who need to catch up on their chronic conditions, and then folks who have neglected acute symptoms who need to be seen.
So the key is don't be afraid to call. Don't be afraid to go in. Don't be afraid to make those appointments. Yeah, and I did one video appointment very early on in the shutdowns, and it worked out really well. So it was really cool. Just logged in through the SCL My Chart thing and placed the call. You're there.
Yeah,
the doc
it's
pops
so
up,
easy.
boom.
Yeah, it's so easy, and actually it's pretty quick. And I would say for probably a third to a half of patients who don't need us to lay hands on them to do a physical exam, it's very effective. And it's something we actually had been doing even before COVID-19 came along. So we were well prepared. And we plan on that continuing to be an important part of our practice because we have so many patients who travel into Billings to be seen, and we can actually take care of them through this remote technology, which is fantastic. So a great option going forward.
Well, and I think, too, some of the telehealth advancements that we saw in the last month where it's like, hey, let's change this regulation, waive this regulation, waive this requirement. It's like, well, some of these waivers, let's keep that going moving forward. Let's make it easier to do telehealth down the road.
Yeah, if you look at two big populations that we were really limited on, number one, Medicare. Believe it or not, Medicare would not pay for video visits before COVID-19.
Even
those are
cheaper.
Patients who most benefit from it, right? It's much more affordable. It's quicker. It's more effective. We can maintain more continuity with patients. And this forced the government to kind of lessen those regulations. And now Medicare, hopefully they will make the decision even after COVID-19 to continue that because it's been a boon. The other thing is seeing patients across state lines. You know, we have so many patients just south of us in Wyoming who come up here for their health care. Across state lines, you couldn't do televideo unless the physician was licensed in both states. That's also been relaxed. That's a huge benefit for patients.
Yeah.
So a lot of good is coming out of changes that were forced to come about because of COVID-19 that are going to help patients.
Yeah, if it has made sense now, well, let's keep it making sense moving forward. I do got to give a hats off to St. Vincent Healthcare, by the way, receives their 4th consecutive A grade from Leapfrog for their spring 2020 hospital safety. So a little recognition there. Caller on the line. Let's see. Steve in Kalispell, did you have a quick question or comment?
Hello, good morning.
Morning.
When you have Doc Sears on, it's always one of my favorite days.
Well, great to hear. Thank you.
So let's play what if. I've always wanted to ask this question. Let's say that technology isn't what it is, and maybe communication isn't what it is. We live in possibly a different time, and there was no such label as coronavirus, but it happened in society. When it was all said and done, after the season was over, after the cases had winnowed out, would the world just simply be saying, "Boy, what a bad flu season we had"?
Good question. What if we didn't know anything about COVID-19 coronavirus and we just looked at the numbers? Dr. Sears, your thoughts?
Yeah, great question. And we talked about this a little bit during the break, is what ifs are challenging. But had we not had specific testing that could have identified COVID-19, what we would have seen is a massive cohort of patients who had an influenza-like illness but was different enough from influenza that we would have known, like, this isn't normal influenza. Like, this is way more contagious than influenza is. This is showing up with patterns on x-rays that's different than influenza. This is showing up with loss of taste and smell, which isn't normal with influenza. We just wouldn't have known what it was, but we probably would have labeled it an influenza-like illness, and it would have ravaged and caused death at a scale that we wouldn't have seen any time in our lifetimes. Because
it's hard to say how bad things would have been if we didn't stay at home for at least that would.
And maybe it would have led to us taking the same precautions, because honestly, a lot of us in the healthcare field feel like influenza started out strong this year and then dropped off dramatically because of social distancing, hand hygiene, et cetera. So a lot of the practices that we implemented for COVID-19 also prevented death from influenza. So it may have been that we would have implemented the same things and we would have seen the curve kind of come down the same. But most of us think COVID-19 is so much more contagious that it would have been a massive flu season that we never had seen before in our lifetimes.
And the other challenge is, the other what if question to add on to what Steve says is, well, what if it comes back? What if it comes back in the fall? We'll obviously have to do something, but it seems like what we just went through is kind of unsustainable. So it's almost like, okay, how do we shelter the vulnerable, protect the vulnerable, but still keep our economy largely up and running? Yeah. And I know that's for economists and others.
That's a super important question. That's what people are wrestling with. And I think we have to think that there's going to be a second surge. However, you have to look at, why did we have a surge in the first place? Number one, We didn't know the disease existed when it first showed up. Like now we're learning that it showed up here much earlier than we thought. So we were unaware. Number two, we didn't have testing. So we couldn't target folks and isolate those who had symptoms right off the bat. And so now that we're aware, right, you wouldn't have to do the exact same thing we did last time, because you could very quickly test someone, have an answer very quickly, and if you have the disease, you can be isolated. The risk of you spreading the disease during a second surge would be much lower. Also, in those communities that have had a high prevalence of it, like the New York cities where 40% of the population has had it, right, their ability to prevent a second surge is better than ours in Montana, actually, because they have what we've called herd immunity. Here in Montana,
because
we don't
more
have
people have gotten it.
Yeah, we don't have a lot of herd immunity in Montana. So all of a sudden, late in the summer, we got all kinds of people coming from around the country that bring it with them. We need to have testing immediately available. So as soon as people have symptoms, we test and isolate them. So we can prevent a second surge by what we've learned from the first surge, right? So it's not going to repeat itself. What if we did nothing different? Yeah, it'd be horrible, but we're going to do things differently. So people should stop thinking like we're just going to do things the same and the same thing's going to happen. No, it's not, because we've learned and we're going to do things better.
And even the people, if the government didn't put out any mandates or any guidelines right now, people would be doing things differently because
you and I are doing things differently.
Yeah,
and then not because the government's telling us or spying on us. We've just learned that we need to do things differently.
You've got some good tips here that I know. Your hospital, all three hospitals in the Billings area, but have come together on as part of the Unified Health Command. Kind of tips for daily living, expectations going forward. What are some of the main ones that you would emphasize?
Yeah, I mean, I think these are really important, and a lot of them are common sense that folks will understand. But it's, that COVID-15, we joke about it a little bit, but it's a big deal. And so people need to recognize that when you're at home more and you have more access to your pantry and you have more access to snacking, you have to develop lifestyle changes that allow you to still eat healthy. When you're bored, don't go snack to treat your boredom. When you're feeling stressed, don't go eat to treat your boredom. So you need to eat healthy, having regular meals. You need to really have a structured day. I've seen lots of memes that people have seen, it's no longer Monday, Tuesday, Wednesday. It's this day, that day, the other day.
Yeah.
Because people just get blurred, right? It's even hard to know what the weekend is because it looks so similar to the week. So having a very structured day. And then really, one of the things is limiting your social media, because you cannot verify the information being spread across social media. So go to a reliable source, even mainstream media on CNN and Fox News and a lot of affiliates. Just be cautious. Is this a news segment, or is this kind of a discussion that's riling up feelings? And
are they just trying to get me to click on their website so that they can boost their numbers?
Yeah,
you know what I mean?
And you can often tell, is it building hysteria, or is it just giving me good information?
Yeah, think positively and limit social media. I thought those two were very interesting to be very at the top of the list. Basically, they're trying to reassure people, hey, don't freak out based on some of the stuff that you're hearing out there. Yeah. Take it seriously, yes, but don't freak out either. The masks, Costco now requiring masks across the country. I think I saw a news piece. The Surgeon General is basically saying, look, if you're not wearing the mask right, if you're not using proper procedures, wearing the mask is worthless. And I think you made that point very early on. Yeah,
the mask is such a loaded question, and people struggle with, should I wear a mask in public? If you use a mask appropriately, it probably reduces the spread of coronavirus. You have to remember that when people do studies, right, there's very strict protocols. Certain kinds of masks, certain kind of hygiene, making sure you're not touching your mask. And then you extrapolate that and you say, this is what happens with everybody. If you go to Costco and you watch people with their masks, they're touching their mask constantly, and then they're touching their grocery cart, and then they're touching a box on the shelf, and then they're putting the box back, and then they're touching their mask. I'm not saying that people shouldn't wear masks. People should use appropriate cautionary behavior, use a mask appropriately. We're using them in our clinic where the providers are wearing the mask for the patients, and any patient with symptoms is being provided a mask, or anybody who wants a mask can have a mask. Wearing a mask appropriately can prevent transmission. And so
but if you're fidgeting with it and doing all this, it's
if
like,
you're touching your face and not washing your hands, the mask isn't going to help you.
There's no point of it. Yeah. All right. I got another caller on the line. Nathan in Bozeman on with Dr. Scott Sears from St. Vincent Healthcare. Nathan, did you have a quick question or comment?
Yeah, so it seems like obviously from what we've learned, as like Rush is saying, California already had the main epidemic before we even found out about the disease. And so once people find out about it, they turn it into an epidemic and get everybody all scared and going. I just think the timeline of which things have already happened, it already happened. And for it to come back, yeah, it'll come back like any normal flu or cold. But I got the date for you exactly when it's going to come back. It's going to come back November 6th. They're going to tell you can't go out and vote because there's a mad Wuhan flu. And that's the timeline of which things are happening. Otherwise, if they would have known about it before, they would have pressed the idea, too, of, we got an epidemic going on, but they didn't. And California already had the epidemic.
All right, good question. So Rush Limbaugh, I don't know if you had heard this. He was raising the question, which is kind of your point about herd immunity in New York, that now New York will have more herd immunity because they had more cases of it. Because Rush was asking the question, wouldn't California be getting hit harder than anywhere else? They have more direct connections to the Chinese mainland with people that are from there, families that are from there, travel back and forth. And so it was interesting that Rush raised the question of maybe they're not getting hit as hard by it because they already had it and developed more herd immunity. So it was an interesting.
Yeah, it's interesting, and it's all those what ifs, right? Like there's so many things that are unknown. There's also not as much subway traffic in California. And if you look at the New York metro area with public transit, they shut down a lot of businesses before they shut down their subway. And so you take a lot of folks and you stick them in a sardine can underground within 6 feet of each other and make them sit together for a while. They're going to spread the disease more readily. And so there are a lot of reasons that go in why diseases spread, when they spread, and learning as much as we can to prevent it. But it just brings up a good point that we always have to be on the lookout for it. And it is possible that people had this before we really knew what it was. And some communities may have more herd immunity than others. And there are a lot of factors other than just if you had coronavirus that make you immune. And we've talked about this, which is take care of your immune system. California, New York has large incidence of diabetes. And if you have poorly controlled diabetes, your risk of having a bad outcome with coronavirus is much higher. And so taking care of your chronic diseases, washing your hands, getting adequate sleep, exercising, all these things go into whether or not you are susceptible to the illness.
Got a cool story posted at MontanaTalks.com right now. The Montana Air National Guard is going to perform flyovers throughout the state of Montana tomorrow, and the maps are on our website as well of when and where they'll be. But they're going to, give us a salute to the healthcare heroes and other folks on the front lines. I know tomorrow kicks off Nurses Week. Just a hats off, just big thanks to all the nurses out there. Anything you'd say as a doctor, how important the
nurses are the best. If you know a nurse, if you go into a clinic and you see a nurse, express your gratitude for them. Nurses are the most trusted profession in the world, and for good reasons. They're people who simply do what they do because they care about others. So if you have a chance to say thank you to a nurse, take advantage of that this week and let them know how much you care.
While all of this was going on early on, I know there were people wanting to donate coffee, send flowers. Was there just stuff like that going on left and right?
Yeah, I would. Left and right's hard to say, but there was definitely a lot of it where people in our community, particularly in Montana folks are just friendly, and so they think about others commonly. And so here, there were a lot of people reaching out, dropping off pizza, dropping off, food, dropping off flowers for folks, and just really good to see the community appreciation for what people do.
All right. Well, Doc, we got less than a minute to go. Anything else that you want to share that we didn't have time to get to in the last 30 seconds or so?
No, I look forward to, kind of the segment in coming weeks where we can talk about non-COVID stuff. I don't think the day is coming where we're not going to talk about COVID in the next 6 months, honestly. But getting back to other healthcare questions that folks have, those symptoms that they've been neglecting, how to manage their chronic illnesses, it'll be kind of refreshing to talk about other chronic illnesses. But certainly COVID is here to stay.
Yeah, I was almost going to ask you, don't you just miss the days when we could talk about the gout or the diabetes or whatever, just something other than coronavirus and COVID-19? But this is all fascinating stuff. Well, Dr. Sears, always a pleasure. Thank you so much for taking the time out, and we've greatly appreciated your expertise throughout these past few weeks. And we'll enjoy having your expertise in the weeks to come.
Great. Thanks, Aaron.